every week, El Señor Mejia has been coming to our show here on Líderes del Futuro, here on KBBF, and we've been talking about, COVID and the ups and downs that we're going through all the time. And so you're here once again, Señor Mejia. Thank you for making the time. Thank you for being here. If you can give us an update as to what's going on. I know there's some positive information for us, but of course, as I just said in Spanish, is not the time to let our guard down. Can you please educate us?
Yeah, absolutely. No, and thank you for having me, Rafael. Let's talk about the good news first, and that is vaccination. Vaccination keeps advancing, and now we have 81% of our population that is eligible, that is 12 years old and older, is now fully or partially vaccinated. 81%, that's more than 351,000 persons or people who live in our county that have received at least one of the doses. We're also seeing a daily average increase of approximately 1,100 doses administered, with 1,835 administered last Tuesday and 8,500 administered last week. In the meantime, our daily cases are still in average 20 daily cases of COVID for every 100,000 persons in the county. And the case rate for unvaccinated people continues to be high. That is almost 41 per 100,000 and 9.6 for vaccinated residents. The overall positivity rate for the test is 6.3%. And the positivity rate for the fairness metric testings for the lower HIP quarters is 7.4%. Then when it comes to hospitalizations and death, we don't have great news, unfortunately. As of Tuesday, there were 81 persons admitted in the different hospitals in the county, and that includes 16 persons in ICU beds, in the intensive care units beds. Not as many hospitalized people related to COVID have been reported since January this year. It's the highest number since January. The county reported 3 more COVID-related deaths on Tuesday and another 2 on yesterday, on Wednesday. 3 of the 5 deaths were unvaccinated residents. The county has now reported 14 COVID-related deaths in August, along August, and in July, there were 16 people who lost their life due to COVID, most of them, as we know, non-vaccinated people. And all but 8 of the 349 COVID deaths that have occurred in the county have been among unvaccinated residents. A growing numbers of deaths are unvaccinated younger residents. And the cases continue increasing in all of the age groups, but the increase is greater in the 20 to 39 bracket, which has a lagging vaccination rate. The unvaccinated people are 29 more likely to be hospitalized with COVID-19 than those who are fully vaccinated, according to a study released by the Centers for Disease Control last Tuesday. The United States now has an average of 150,000 new cases of COVID daily for the past 7 days, compared with 12,000 in early July. For all these reasons, the county is resumed the weekly informational meetings for COVID-19 for the community. We have 2 sessions every week. The first one is on Wednesdays, and that's in English and has a simultaneous translation to Spanish. And that occurs on Facebook Live for a live stream, and simultaneous interpretation goes to the YouTube channel. And then on Thursdays, like today, we just finished one in Spanish that's completely spoken in Spanish, and then that has interpretation to English too. And also that happens in the YouTube channel. So I invite our listeners to visit these places and look at this our community updates that are 60 minutes of information, questions from the public and questions from the press that can be very interesting. Also, good news is that there's a full FDA approval for the Pfizer vaccine. The Food and Drug Administration on Monday granted full approval to the Pfizer BioNTech coronavirus vaccine for people aged 16 and older, making it the first vaccine in going beyond emergency use status in the United States. The full federal approval is also expected to partially quell misinformation online about the vaccine and induce more undecided people to get vaccinated. The vaccine will continue to be licensed for emergency use for children 12 to 15 years of age, while Pfizer collects the data necessary for approval. Although Pfizer can now market the drug under the name, I'm not sure of the pronunciation, Comirnaty, something like it. The company said only the federal government will continue to distribute doses in the United States. There is also a third dose of Pfizer and Moderna COVID-19 vaccines licensed by the Centers of Disease and Control and Prevention that have been administered to patients who are moderately to severely immunosuppressed. If you are not sure if you qualify for a third dose of Moderna or Pfizer vaccines, check with your primary care physician. For this group of people, these are extra doses, not booster shots. This additional dose is intended to improve the health of immunosuppressed people. The response to your initial series of shots is not the same as that the booster will bring. We have heard that the booster will bring tenfold. This is just to it's a sort of boosting also, but to guarantee more people that has an immunocompromised systems in case that they were infected with COVID, not to suffer severe disease, which is what we are seeing right now in this group, which is 2% of the population in our country that is ending up in the hospital because of a COVID infection post-vaccination. So that's why there's the reason for a third dose while we wait for the boosters. As we know, we announced last week, the President Biden's administration announced on August 18 that it plans to begin rolling out boosters for Pfizer and Moderna starting on September 20th. The program to administer these vaccinations is very similar to the one that we started in December. That means the health workers, the nursing homes residents, and the older adults who were vaccinated early will be first in the line, and so on. Now I want to give you an update about the schools. On August 23rd, Sonoma County issued a health order requiring all private K-2 schools to verify the COVID-19 vaccination status of all workers and require that unvaccinated or partially vaccinated staff submitted to the COVID testing. This order will go into effect on September 24th. An earlier health order gave schools until October 15 to go into compliance, but it has moved earlier to September 24. And this is due to the number of cases that we are seeing in the schools. The cases reported in the first weeks are 38 that has been reported so far, 38 cases of COVID in the schools, 32 of them within the students and 6 of them within the staff. The cases have occurred in 16 elementary schools and 8 high schools. And 2 of these cases were related to sport activities. The health and education officials know that there will be more cases in the future, but said the cases to date are minimal number, given that there are 66,000 public school students in the county and more than 8,000 employees. The vaccinations orders continue expanding. The Sonoma County Superior Court officials announced on Monday that all court employees must be vaccinated within 45 days. The city of Santa Rosa will review by the end of this month a policy that will require their 1,250 employees to be vaccinated as well. The Pentagon said on Monday that it's moving forward with its plans to demand vaccinations for the nation's 1.4 million active duty soldiers. Now that the FDA has full approval for the Pfizer vaccine. And the same with the CVS pharmacies that announced also on Monday that they will mandate the vaccination that covers 100,000 of their employees nationwide. And lastly, I want to give you an update about the reopenings for the homeless shelter in Santa Rosa. The Samuel L. Jones Hall Homeless Shelter in Santa Rosa plans to reopen tomorrow, Friday, to new residents after the COVID-19 outbreak in July 2nd that resulted in 116 cases. The facility is owned by the city of Santa Rosa and is operated by Catholic Charities. The county and the city of Santa Rosa health officers have worked with Catholic Charities on a new screening and health protocols for safe reopening to the residents. The reopening plan includes a reduced shelter capacity, a new resident intake process, and new testing procedures. The capacity of beds on campus, including the main hall and the annex, will be reduced from 213 beds to 120 seat beds. This adjustment is implemented for greater social distancing. Many of the COVID-19 protocols that existed before in the outbreak will continue, such as masking, social distancing, and education and outreach to promote vaccination. And that is the extent of my report.
And I appreciate, as always, that you take the time and you come over and visit with us. Again, the positive here is more people are getting vaccinated. The negative, there are people who are still getting sick. We know that students in elementary schools and middle schools, high schools are getting the virus. This is why we encourage individuals who are 12 and older, or families with 12 and older, to get their kids vaccinated to minimize the chances. And again, for all of us to get vaccinated so that we can protect the ones who cannot be protected, which is the children under 12. And I appreciate that you take the time, that you come over, you update us, and I look forward to our next conversation where we will get an update on the situation with the support that is available for people who are behind on their rent. For now, we are inviting people to just go to the website, socoemergency.org/ is it ERAP?
That's correct.
Okay.
ERAP.
Thank you. And so again, I look forward to our next dialogue, Senor Mejia, and I appreciate your willingness to always come back to the show and update us on what's going on in Sonoma County.
Thank you, Rafael, and I look forward to see you next Thursday.
Take care.
Thank you.